Hello, everyone. Today we are welcoming Jill to the show. She is in Winter Park, Florida, where she just told me it is 90 degrees and we are recovering from an ice storm here in Detroit. So I'm already very jealous and I think I'm going to go visit Jill. Jill, welcome to the show.
Thanks so much for having me.
We're so grateful to have you on today and we look forward to chatting with you. I always like to start off with, why don't you just tell us a little bit about yourself, anything and everything you want to share?
Sure. Um, let's see, I have three beautiful children. Two of them were kind of miracle babies. My first child has got autism and he's doing really good now. He's 20 years old. I can't believe that. And I live in Winter Park. I live in Florida. My two little ones, they're into acting and modeling. So that keeps us really busy. I homeschool the two little ones, and I did homeschool my oldest one. And he finished last year. So this is his first year, not in regular school, but he's doing, he's in a program for kids with autism that helps them train in specialties so that they can kind of be ready for a job, but they don't offer degrees. And so that keeps us busy. I like to play tennis when I'm not doing other things. That's something that keeps me busy. And we have three dogs. We have three poodles, a standard poodle who is we like to dye pink, and so that's fun. And then we have two toy poodles. And so we're into poodles and tennis and acting and homeschool. That keeps us pretty busy.
I was
And
going
we
to say,
love but the beach, our beach house got ruined in the last hurricane. So our beach time has been a little bit not so much kind of until we can get it repaired. So that's kind of what we're all about.
oh, I'm so sorry to hear that that happened. But yes, you do sound, that sounds like you are very busy. I picture you driving around a lot, going from place to place, and
I live in my car and it's a jump pit right now. There's
that's what
trash on the
happens.
floor. I get in the car and I'm called, my son calls me the moober, the mommy Uber. I'm a mover.
Yeah, I probably, and then like the dogs probably are in the car
Yes, oh
sometimes.
yes, oh yes, they're
I
all
bet it's
great.
crazy.
They look at me in the laundry room like, are you going to take me this time? So, yeah, I spend a lot of time in the car. So that
Yeah.
is another pastime. I can't say that I enjoy it at all.
No, no, for sure. You're Ubering everybody around.
Yes.
Well, thank you so much for being on and sharing with us today. And I like to really start off with, with endometriosis, when you remember potentially some symptoms starting for you, what they were, and how things started to progress for you with this
Um,
disease.
well, a reason why the autism comes in is because when we were treating my son, we have a hyperbaric chamber, and a lot of the autism conferences say, follow some of the same protocols your child follows, because if they're inflamed with autism, most likely you're inflamed. But I never gave too much thought to endometriosis, even though my mom had endometriosis. I always had cycles that were heavy and clotty, but I never was one that would be in bed with cramps or debilitating pain. So I never gave it too much thought. And because I had no problem getting pregnant with Jake, my first child, I didn't really even consider it. And Jake was 7 years old, and I decided I would really like to have another baby. And he was to the point in his autism journey where I felt like um, he was ready. We had recovered some, and I was ready, and I could devote time to a new baby. And I was having trouble getting pregnant. And so I went to a fertility doctor, and he said that I had premature ovarian failure. I had high FSH and low AMH. And I said, what does that mean? And I had cysts, and I ended up switching to a different doctor, and he treated me, and he said, okay, the first thing we need to do is a laparoscopy. And they put me on the birth control pill first to see if any of the cysts would go away, and they didn't. So we did a laparoscopy, and they drained one of the big blood endometriomas, and they drained it, but they couldn't get the whole part of it off. So I had to go back again, and that happened 9 months later. And then another 9 months later, I went back. So I'd had three laparoscopies all within 9 months of one another.
Did they
And
say, Jill, sorry to interrupt, did they say endometriosis to you or anything, or is
they
it
did.
just you have cysts?
They documented it as stage 4 endometriosis. And they
Okay,
asked me if I had any symptoms. And I said, not so much, other than the clotty cycles. They were always on time. I always had a regular cycle, but they were very heavy and they were very clotty. And they told me lots of times the people that have the worst endometriosis are the ones that feel it the least. So when I went back to think about it, I thought, okay, and what can I do to make it better? And so I started trying to do some home remedies like castor oil packs. I saw an acupuncturist, and they taught me about moxa, which is a like a burning stick, and I would do that around my ovaries and my uterus. And so that helped with some of the clotting, making the clotting less. And as I got further in my fertility journey, I would say that's when I started having the pain. I didn't have any pain necessarily before I knew, but after they started treating me, and then I started having some of the when they started opening me up, and but
sure.
I
Three
didn't really,
surgeries
yeah, I
like
had
that
three
back
surgeries.
to back.
And so that's when it called my attention more to my ovaries, and I would have ovarian pain because I had a cyst burst on me. And
Mm.
so that was leading up to the second laparoscopy. The first laparoscopy, they drained that endometrioma, but they drained it, it filled back up, and then it burst.
Oh,
And that's when I started having the pain. And
sure.
so they did a second laparoscopy, and they didn't check my uterus. And so then they went back and they said, oh, you have a fibroid and you have two more cysts. And so towards the latter part of that journey is when I started having pain, because I had had a C-section with Jake. And then it's coming on 10 years later, obviously, because I had, when I finally did get pregnant, it was 10 years from my first child. But I had had the adhesions from the first C-section, and I had had the adhesions from the laparoscopies. And in the laparoscopies, they cut you in 4 places. They cut you in your belly button, your left ovary, your right ovary, and they also cut you in your C-section scar. And so I had that done 3 times, and they were all 9 months apart from one another. So I was probably pretty scarred up and pretty restricted. And so the more that they cut me, it was kind of like a bad cycle. The more they
Yeah,
cut me, the more pain I was in. And but leading up to it, when you asked that original question, I didn't even know I had it.
right.
And I
Right.
was doing a lot of anti-inflammatories, and I was doing acupuncture, and I was in my hyperbaric every day because of Jake. So when it was actually called to my attention and then they started working on me, that's when I was like, well, something's not right.
Right. Right. And then so you started to experience pain. And what type of pain were you having?
A lot of the pain was in my ovaries. Um, and then because of adhesions, I had a lot of lower back pain.
Yeah.
And that was very uncomfortable. And usually the lower back pain would spike during a cycle.
Hmm.
Um, that's more or less when I felt a lot of the lower back pain. And so that wasn't any fun at all. Um,
No. And
and
are
I
you doing fertility treatment at this time as well, or are you just going through this process trying to remove the cyst?
Well, I was trying to. So they wouldn't treat me for IVF until after I had my laparoscopy. And
Right.
then, so I had the laparoscopy and then we did an IVF, which made me more cysty.
Mhm.
And that first IVF failed. And then I had recurring cysts. So I had another laparoscopy, and then they did a frozen transfer. And the meds that they stimulate you with is what helped cause some of those cysts.
Yeah.
So, so we did a frozen transfer, and that I was like borderline pregnant. I guess my levels were very low, and then I lost it. And so it wasn't a fun process.
Yeah. Very
But
hard.
yeah, I
Yeah.
was going through for I was they have that protocol where they have to work with your FSH usually and your AMH, and then they have to scan you to make sure you have no cysts, especially if they're stimulating you. And so it wasn't until after I got through my treatment with Clear Passage that I went in another direction than IVF. We went with IUI and no stimulation, and we were successful that way. But we realized that in the process, that some of those medicines that were for stimulating the egg production were indeed causing me to be cysty.
Right.
So,
So
yeah.
you go through these three surgeries and these cysts keep coming and you're dealing with that situation. What, first off, how are you doing? Like, this is a lot on
Oh,
you.
it's miserable. It was
Yeah.
so miserable and disheartening. And I just, everybody kept mentioning my age because I was 37 when I started. And, the hope starts dwindling and dwindling.
Yeah.
I was fortunate that I was still having a cycle, so that was promising despite my numbers. Some people put a lot of emphasis on numbers, other people don't so much. So I was always thankful when I found people that were like, this can happen regardless of your numbers. Um, I did a lot of meditation in the process. I did acupuncture, um, and I did a lot of walking. Um, but I had to also care for my son, who I was homeschooling, and my one of my aside from really wanting a baby, I wanted another baby so that he wouldn't be on his own. I wanted him to have a sibling because I'm an only child, and we are not very close with our family, and so there's not a lot of little ones. So I wanted him to have a sibling that I didn't have.
Mhm.
So that was important to me. And so it was a real struggle. It's very up and down, up and
Yeah.
down. You have hope, and then the hope sometimes fades, and then you have to get back in a good headspace to keep going and keep your goal in sight and really know how important that is to you. And it was so important to me. So it was worth doing everything I could. I mean, I did
Right.
whatever I could. And the doctors got so frustrated too because they would say, your file is this big, you're making us look bad. And, I was looking for every which way in between that I could help the process. And so if it was a castor oil pack, I did that, walking, massage, acupuncture. And so I did whatever I could to
Yeah.
try to help the process, but it's a long and arduous
Yeah.
road. Diet, supplements, you name it, I did it.
Yeah. So after those three surgeries and everything, what did you do next?
After the last surgery and then the last IUI, um, I finally I had looked up clear passage therapies every time I had to have a laparoscopy. And I thought, oh, I won't do it. It was a time commitment, and it was, something I thought, I don't know if none of this other stuff can work, how can this work? So after the third laparoscopy and after I was partially pregnant or whatever wording you want to call it, I said, enough's enough. And I called Clear Passage and I had said I'd looked them up multiple times and I hadn't acted on it. I told them my story. I said, this is the last effort that I have. This is the last option that I have, or the last hope that I have of even trying to make it possible. But even if a baby doesn't result, perhaps you can make the endometriosis better, because it was to the point where it was really miserable now. And I said, but my end goal would be, you know, to have another baby. So they reviewed my case, and it was right before spring break. So there were not very many people down there, and they were able to squeeze me in. And so I drove up every day and came home because my husband was out of town and I had a nanny to watch my son. So I drove up in the morning and I had my treatment, and they were accommodating with my schedule. And then I would drive home at night. And I did that for the full 20 hours, um, which was 4 hours a day. And you had a lunch break and you had walking that you needed to do before you drove home. So I did that. And I came back, and I wanted to go try again for my to see what the doctor would say. And he said, I think you're just crazy. I don't think that that would have made any difference for you. And I said, okay, we'll see. So he said, your hormones are too high to do IVF, so let's just do IUI. And I said, that's fine. So they gave me an Avadril, and which helped the ovaries pop the eggs out. And they followed up with estrace and progesterone. And we did that in July after, and my treatment was in April. It started April 2nd of 2012. And so I was there for that full week. And then the month of July, I found out at the end of July that I was pregnant. And then I had my son exactly 1 year to the day that I began my therapy in 2012. So I started April 2nd, 2012, and then I had my son April 2nd, 2013. So it was a real wink that it was the right choice. It was amazing because I had gotten home in April, and we had waited we had waited a couple months, and then we decided to try. And it was like a miracle. The doctor couldn't believe it. He sat there and he told me, he's like, Jill, don't take any pictures, don't tell anybody, don't do anything, you don't want to jinx this. But it was a healthy pregnancy. I didn't have any issues. I felt good. And it was just the most amazing thing. I had told Larry and Belinda I wanted to be one of their stories in their book, because, every time I was feeling down in so many of those moments, before having gotten pregnant and going through that process, I had their book and I would read the stories about people and see that it was possible. And so it would give me hope and it would lift me up. And I think, okay, I can do this. I'm not willing to give it up yet. I don't want to be a person that gives up on this. And so it was just amazing.
That's incredible. So for a lot of our listeners, they may not know about Larry and Belinda's book or what Clear Passage is. So how did you come upon Clear Passage? Can you tell us just a little?
Yes.
I know we have Larry here too, will come on as a cameo
course,
later, but how did you discover them and the book? And just for people who are listening, that are like, I have no idea what you're talking about, Jill.
Sure. So, of course, probably like every other woman that wants to get pregnant or learn something, late nights on the computer researching alternative care for whatever it was. I had lots of experience doing the same thing for autism, so I was going to do the same thing for endometriosis. And so in my search, a Clear Passage always came up, and I was like, it's in Florida. I'm in Florida. Let me just investigate this more. And then, so I read everything on their website, and then they had a book. So I ordered their book. It's called Miracle Moms, Better Sex, Less Pain. So I ordered it and I started reading these stories, and I was thinking, there's something to this. There's something to this. And I was hesitant and I was hesitant. And then I just had a moment after that one call where the lady said, your numbers are indicating you're pregnant, but then I had a bleed and I lost it. And I was like, that's it. I'm done. I'm not going to go, I'm going to have to incorporate that route for myself with the fertility doctor. But before I get there, I want to try this option. And in their literature for clear passage, it had said there's a lot of success for people, whether they're doing IUI or IVF or even trying to get pregnant naturally. Their chances are increased if they um, have the hands-on manipulation therapy to help release some of those adhesions in your body. And I mean, I was full of adhesions, and I had had so many surgeries. I had had a C-section and then 3 laparoscopies, and then just everyday wear and tear on your body. You have falls, you have, you know, bumps and bruises, and you bump into things, and you just take some Advil and keep going, but you don't
Yeah.
really think about maybe what it's doing to your body or the scars that it's leaving inside of your body.
Right. Right. Absolutely.
Yeah.
That's, I mean, incredible that you went in April and a year later.
Yeah. Oh, it was fabulous.
Oh my goodness. So what happened after that?
So after I had Jack, I was so excited and I healed from my C-section. But the first thing that I did was I went back to Clear Passage to have them work on those adhesions from the new C-section.
Right.
Because now I'd had 2 C-sections in the same place. And if you're familiar with how that works, it just kind of keeps getting deeper and deeper, the scar tissue. So I thought to myself, maybe I'd like to try one more time for a little girl. So I wanted to keep my options open. So I went back and was treated just 10 hours just to have them work on my C-section. And then I got to a point where I thought I'm ready to try again. So I had weaned Jack and I got pregnant a second time with the same protocol that we used for Jack, which was let's monitor the status of my ovaries. When it looks like my ovaries have mature eggs, let's use an Ovidrel. Let's follow up with estrace and progesterone after the IUI. And on the 3rd try with Jenna at 41, I got pregnant and they were baffled because they couldn't find her. She was sitting so high up. And so I was in my 3rd ultrasound and they're like, come back. And then they ended up calling and saying, you're pregnant. They saw a little sac. So I had her at 42. And then again, after I'd had her and I had healed from my C-section, I did go back because I was in such a good place after my treatment with the endo. I wasn't having pain. I was having regular cycles that weren't so miserably heavy. There wasn't much cramping. And so I felt better just in general having had the treatment. So getting treated for the endometriosis and the adhesions, it was like a bonus. And those adhesions can do miserable things to your body. They pull and tug on your body, which makes you sometimes lopsided or makes your back hurt or pulls on things. My because my adhesions were so bad, my uterus was attached to my bowel and my uterus were attached together. And that doesn't feel good either. I mean, it just causes so much restriction in your body. And so having that treatment gave me peace of mind that for my endo, I didn't want to have to go back and have another surgery. I was petrified of having more cysts, and I didn't have any issues. And I made sure that I did breastfeed after each of the babies too, which kind of puts my cycle off. It puts your cycle off or delay it from coming back. And so I did whatever I could do to kind of keep that endo at bay. But the best thing that I ever did, I sound like an infomercial, but the best thing that I ever did was go to Clear Passage. I mean, they gave me my life back, and I have 2 miracle babies because of them. And but I followed they were so great to me when I was there, and walked me through so many things and talked to me about how numbers aren't everything, and they weren't. And you could, every once in a while, you'd read a story about how a lady got pregnant despite her numbers. And in those fertility clinics, so much of it is numbers based. They
Yeah.
don't operate without certain numbers, because if your numbers are high, it lessens their chance of having a productive pregnancy, which, their numbers get logged someplace so people can look up their successes and pregnancy success, and so they wouldn't want to take a chance. And despite that, so I just felt like that was my last hope. And I told them that. And so it was so healing when I was there, because you kind of remember some things when you're going through the treatment. And I remembered I'd had a fall, and I had fallen on my tailbone, and my tailbone was kind of cupped upwards. So, they said, well, that's definite too for maybe making the endometriosis worse. If you had it and you were dealing with it, fine. But if you fall, and then that's just going to compound the issue. So that could have been a big issue. And I felt like when I left there, my posture was better, and I was, I took a little bit more time for myself, and I left with directions on stretching that were good for me. It was like my own little time and routine that I would do every night before I went to bed. And so I followed all their protocols, and it really it paid off for me. And I was just so thankful for that time. It's a time commitment. I went the full 20 hours when I first went, because I wanted to make sure that I had the best chances possible at just getting better. Number one, the baby was a bonus. It
How do
was
you
my goal.
feel today? How do you feel
I feel
now?
good. I haven't had any issues since. No
That's
issues since.
wonderful. That's wonderful. So people, now Larry is here with us, but Larry and Jill are both here if you're listening and or watching. But so people are going to say, well, what did they do? What was this thing that they did to help you? So 20 hours, 10 hours. So listeners who may not know anything about this treatment method may be a little confused. So Jill, maybe you can tell us a little from your perspective of what was done. And then Larry, if you can tell
Yes,
us
that'd be great.
all
Um,
about the technical version.
Larry and Belinda founded a method after she was treated for cancer to help lessen her pain, and it was hands-on manipulation. And it's internal and external. So the internal part maybe not so fun, but it's done in a very dignified and in nice manner. You don't feel like I mean, it's not anything that's fun for anybody, but if you've got to do it, it's done most respectfully there. And so a lot of it was hands-on, pressing on spots until they could feel a release of an adhesion, and they just worked their way around my body. But before they began, they took measurements of how I was standing and what my posture was, and where it looked like there was maybe a tug or a pull, and how I was standing, and asked me, where do I hold my stress? Is it in my neck? Is it in my back? And then they just would have different hours through the day where they would work different parts of my body. And it's a very quiet and very healing and nice environment to do that. And so some of it does get uncomfortable if they're working on an especially tight adhesion, but it doesn't stay uncomfortable. And it's probably it's way better than having surgery. I can tell you
Yeah,
that.
were you sore
I
after?
did the surgery route 3 times, and that was no walk in the park.
Yeah.
Sometimes at the end of the day, I would be a little bit sore, but they're very gracious in the bathroom. They have Advil and everything that you could need, and they
Drink
give you
lots of water,
lots
right?
of water, lots of fluffy robes. And so at the end of the day, they really, and at lunch break, they ask you to walk in between sessions, because that helps keep everything loose. And so I followed their directions, drank lots of water, did lots of walking. I took my Advil when I was done. I might have had a couple little bruises here and there on the places they really had to press hard on. But overall, that pain didn't last. That soreness or achiness didn't last. And they tell you may have some of that up front. But
Yeah.
I didn't have a lot. I mean, in comparison to what I would be dealing with endo wise, it was nothing. It was easily treatable with Advil.
So Larry, tell us about this method
Mm.
and tell us about Clear Passage, and welcome to the
Okay,
show.
thank you. Can you hear me okay?
We
Yes.
can.
Okay, good. So basically, yeah, I mean, as Jill said, we started when my wife developed, who's summa cum laude physical therapist, developed massive adhesions after pelvic radiation and surgery for cancer. And she was in debilitating pain a year later, and doctors said, "Oh, that's adhesions. We don't know what to do with adhesions in medicine. If we cut, we're just going to make more adhesions. So just learn to live with the pain." So we didn't want to do that. So we started examining how to decrease adhesions, finally came up with decreasing them actually using our hands. It feels like pulling out the run in a sweater in very ridiculously slow motion. Um, and so we were treating first Belinda, and she went back to work and did great. So we started treating other patients with pain, and then women with blocked fallopian tubes, their tubes started opening, and we were shocked because we were not expecting or trying that. And the chief of staff of the hospital said, "Well, this is remarkable. You're doing things with your hands I don't think I could do surgically. We can actually test this by seeing whether or not you're opening tubes by doing before and after dye tests when you treat." And we did that. Then I remember the first, we were so naive about women's health really at the time. We were just treating adhesions, and this woman comes in and she said, "It's amazing. My period came and I didn't even know it was coming, because I'm generally on the ground for a couple or 3 days with every time my period comes." And we said, "Okay. Yeah, but now that you treated me, I've had that for years, and now it came and I didn't even know it was coming, because I have endometriosis."
Mhm.
And we said, "Oh, okay."
Wow.
She left, and Belinda and I looked at each other and said, "What's endometriosis?" Because we really didn't know way back then, 30
Yeah.
years ago, what that was, as so many people do not. So all we have been doing this entire time for the last 35 years is decreasing adhesions. And it works in areas as small as fallopian tubes. Our success rate for endometriosis for pregnancy is 43%, and that includes women with endo and totally blocked fallopian tubes. So if you don't have totally blocked fallopian tubes, I'm sure it's higher than that. So what happens, however, the endometriosis arrives within your body, and it generally starts in your pelvis and can spread anywhere in the interstitial spaces between organs and structures. Wherever it lands, it creates some inflammation. And your body goes, "Oh, there's inflammation there. Let me send in some crosslinks. Let me send these little building blocks of adhesions to surround the area to help so the white blood cells can fight off the inflammation." Well, once they fought it off, you have an internal scar there, and the body just doesn't have a way of getting rid of that scar. And now when you reach up and you pull and you're trying to grab something, it pulls here. Or like in Jill's case, as she talked about standing up straighter, it'll pull you forward, and now your head and shoulders are forward, your back's starting to hurt because these little 2,000-pound disclerance bonds are pulling you forward. So what we found is that we can't detach the bonds. The bonds themselves are about 2,000 pounds of squarence, the little strands, but where each of them attaches to the next and the next and the next, there's a molecular chemical bond. And as we get on the area after 35 years of research doing this, we stay with it long enough and just know how to work it to dissolve those bonds. And as we do, those strands start detaching from each other. And it is very much like pulling out the run in a three-dimensional sweater, if you will. And it kind of takes you back in time. And that's what happened for Jill, and that's what happens really for all of our patients, where these scars and internal adhesions have formed, but they're because they were needed at one point, but they're no longer needed. They're just acting like glue or straitjackets now.
And I
So
had endo
that's
so bad, it was on my appendix. And that's only on 2% of people. And they told me, oh, you have it so bad, it was on your appendix. And only 2% of the population gets it there. So I had my appendix taken out in my second surgery. And I remember waking up and the lady's like, I guess I need to tell her now. They had taken that out. I mean, it was everywhere. It was terrible. So
right. And then you had adhesions attaching your uterus to your bowel.
yes. Oh, the bowel and they were together. And
Right.
so it made sometimes going to the bathroom painful. It was a mess. It was a big mess.
Yeah.
And whether or not that was from the endo that had escaped and just landed there, or when you think about it with a woman's reproductive structures, you have this warm, moist, dark environment that's designed to nurture life, and you have things going into you from the outside world that are not always sterile when you're having intercourse or such. And those things, so they a little bit of bacteria enters there. It's in a warm, moist, dark environment. It goes, oh my gosh, this is wonderful. I could just grow here.
Right.
And so these little adhesions start to form from that infection. And that's where people with endometriosis, so many of them have intercourse pain, because this area that should be pliable and pleasurable, when it's moved now, it has little bonds like little curtains or straitjackets attached to it. So anything that's in there starts to hurt. And that's
And
another
Larry,
problem.
you had said those happen also from yeast infections and bladder infections too, right?
That's
So,
oh
so-
yeah,
yeah.
yeah.
And so if you ever have
Just
had a yeast
area.
infection, which is common, and bladder infections, which I grew up with terrible bladder infections. For some reason. So I had a procedure when I was itty bitty, and I forget even what it was called, but it was from having recurrent bladder infection. So they just, those adhesions, they just build up over time,
Mm. Yeah,
after
especially
37.
after surgery. I mean,
Yeah.
multiple, people with endo are having these multiple surgeries on top of already having the adhesions from the endometriosis. So it's just
Mhm.
perpetuating it
Right.
even more. Yeah,
That's right.
absolutely.
And no matter how wonderful and skilled and compassionate your doctor is, and gynecologists are some of the most compassionate professionals we've ever met, they cannot help but create more adhesions, because that's how the body heals from
Heals.
surgery.
Yeah.
Yeah.
So every time you have a surgery, generally speaking, it creates more.
Yeah.
Yeah, and speaking of that, when I was having my third C-section with Jenna, they were like, we're almost there. It just takes us a while to get through all that scar tissue. So you can imagine, as those build up, I mean, they were really having to cut hard to get her out.
Sure.
Because it had been, 2 other C-sections plus the laparoscopy. So those things, they just build on top of one another, is the way they made it sound to me. It was a pretty thick area of scar tissue in
right.
that pelvic area. So
Yeah.
they,
Well,
no
Larry, I
fun.
think what you guys are doing is great, and you have locations all over. You're not just in Florida. We're a global show, so people from all over the world listen to this show. So if people are looking to find you or find more information, is it best to go to your website?
You just go to clearpassage.com. If you can see where our locations are from LA to London, and we have even one right at the Channel entrance from Europe, in England. But if you complete a medical history form there, we will review it and we'll let you know, you're appropriate or you're not appropriate. We're glad to talk to you about it. There's no charge for any of that stuff. We're going to tell you the truth. I mean, this is important. We're dealing sometimes with life and death situations, and of course, having a child it's your dream. So just complete a medical history form there, and then we'll tell you, we can kind of fill you in on everything. It does have the advantage of no drugs and no surgery, which is um, huge, I guess. And the
Huge.
success rates are actually a little bit higher than IVF, so cost less.
Yeah. I mean, it's absolutely incredible what you two are doing, and I'm so grateful, Jill, for you sharing your story, very personal story, obviously, and Larry for all the work you and Belinda have done, and you're helping so many people. Is there anything either one of you would like to add before we wrap up? A lot of people with endometriosis listening to the show that might be at the very beginning of their journey. They may not have a diagnosis, or people who have had 20 surgeries. I mean, there's a variety of people listening. Any
I would
advice?
that even if you do go that route with IVF or IUI, before you go that route, have the clear passage treatment, because that's what I had to do. I couldn't do it on my own after clear passage, but combining the two and joining the forces was what made it a success for me. So there's nothing wrong with doing that, to make it a team effort. I mean, that's what I had to do, but I didn't have a lot of time. Somebody may have more time. I was 37 when I started my journey, and I was 40 when I had Jack, and I was 42 when I had Jenna. So I didn't have so much time. But I think about, had I gone to clear passage first, what perhaps might have been, I might have had been able to save myself all those laparoscopies and
Sure.
meds for stimulation. Because one thing that I wanted to mention was, after clear passage, I wasn't stimulated for my eggs when I did my IUI. And that was really important. I think that the eggs can grow a little better in those ovaries when there's less restriction. And so that was really important, because they like to stimulate you with those meds. And that was not a good thing for me in my case. And so the fact that I had stage 4 endo, and I was 40 years old, and I got pregnant with my own eggs without stimulation, I thought was huge, because my numbers, like I talked with Larry said, Jill, don't worry about the numbers. And that was really hard to let go of, because the whole process, going through that whole fertility process, is all about numbers. The first thing they do is take your blood and check your numbers. So knowing that I had a high FSH and a low AMH, and knowing that I was almost 40 years old, and then not having to be stimulated and getting pregnant so quickly with a little bit of help. I mean, it was an Ovidril, an IUI, and then estrase and progesterone. That's pretty fantastic. And I think the quality of eggs improved probably after that treatment, because when I was doing IVF, I didn't have that many eggs that were of good quality. I mean, they retrieved maybe 10, which wasn't much. And out of those 10, I had 3. And when I had completed my process through clear passage, I had just as many quality eggs, as far as I'm concerned, on the ultrasound without stimulation. So I may have had fewer eggs, but they were more quality because they had an environment where they could grow better. I can only imagine, if you're in a little ball and the ball is like squished or half available, half open, you can't really grow that well.
Yeah.
So I think there's something to that.
Amazing what the body does on its own. It might be useful to know the most appropriate people to consider this therapy. I mean, if you're young, you have endometriosis, and you're having pain, and you're not thinking about having kids, so you can try some hormone medications just to stop your periods, and it'll stop the swelling, so it stops the pain. Once you start thinking about, I want to have children, or if you have intercourse pain with intercourse, we're up in the 90 percentiles for decreasing that. And there's really nothing in medicine that we know of that does that. They give you the desensitizing agents. things where you don't really want to be desensitized, you just don't want to have pain. So those would be the most appropriate. If you're looking and considering a surgery, we did do a study where compared us to surgery, and the results a year out, and we were virtually the same as surgery, but not creating more adhesions. A lot of women say to us, and a lot of patients say to us, I've had so many surgeries, I must be so complicated. It must be so hard. I don't think you can help me. Those are actually some of our best patients, or our most appropriate patients, because when you're so adhered, it gives us really more to grasp and more to pull apart. And it's kind of like really going back decades,
Yeah.
over the time that these things form. So that has really not been a problem, which you might have thought it would be, the multiple surgeries and long term. And well, Jill was stage 4 endometriosis. I mean, she'd had it for years, and multiple surgeries. I think you're a perfect example. And I loved what you said about how your body just responds by itself when it's taken out of these adhesive bonds, these 2,000-pound square inch straitjackets, and allowed to react on its own and to do what it's supposed to do.
Yeah,
So
it just it changed my life. And I would say if you're thinking about it, do it. I know that it's a time commitment, and I think that's probably what people first think of was, oh dear, do I have a whole week? Well, I just make it work, because it would be the best choice that you can make. It was the best choice for me. It may not be the best choice for everybody, but if you don't want to have surgery and you don't like the meds and all that other stuff that goes along with it stopped that endless cycle for me, that endless, okay, let's go get a surgery, let's see how long it lasts, what's going to happen this month. It just stopped all of that in its tracks. I came home and like you were giving the example of the other patient and thinking, okay, my back's hurting, I'm waiting for my cycle to start. And I remember when mine started, it started and I had no idea it was going to start. And so it took a lot of that preemptive pain away, that lower back pain. That's where I felt it the most. It took a lot of that away. And so it made life so much better. There was so much more ease to it, and it made that whole process of that fertility cycle so much better. The doctors didn't believe me. I walked in there and I told them, this is what I did. And they're like, okay, Jill, whatever you've done this month, because by that time, it just seemed like I was kind of a little bit of a wackaloon, because I was, telling them, oh, I did a castor oil pack, or I was doing mock stuff from my acupuncturist. And, this time I came in and I told them I had been to Clear Passage. They're like, whatever, okay.
Right.
And so I proved them wrong. And there was nothing more satisfying than proving them wrong. When they tell you, you're making them look bad and your file is so large, and, they didn't really know what to do with me. But I have to give them credit. They gave me a couple more shots, and I proved myself successful. So that was because of Clear Passage. And so when we went back and I said, we're going to try one more time, they were like, okay, then we're going to not rock the boat and we'll do the same protocol that we used with Jack. And we were successful with Jenna. So that's what I said, teaming the options together really increases your opportunities or your chances, I think.
Well, I think the other thing that we should mention is there's a lot of people who can't access surgery. A lot of these endometriosis surgeons don't take medical insurance. And, it's very, very expensive. And I know obviously Clear Passage has a cost associated with it too, but my assumption is not as high as some of the surgeries that need to be done. And you're considering surgery, which I'm sure, Larry, you will tell me the risks of coming to Clear Passage are probably a lot less than having a surgical procedure.
The risk is pretty much temporary soreness, increased desire, arousal, lubrication, orgasm, and decreased pain, which people started calling us, telling us they were having orgasms like they'd never had in their lives. My wife asked me what I should do with that information. I said, look, we're already the weird practice in town. Don't even mention it. The staff at the hospital said, that's phenomenal. We don't have anything in medicine that does that. We ended up presenting at the American Society for Reproductive Medicine on that aspect. So I know we help all of those. One area that Jill touched on, and I think it's important to mention because so many of us have had a fall in life, roller skating, ice skating, whatever, at some point earlier in life. When you have a fall on your tailbone, and this may have happened with you, Jill, if you're about to, if you have a fall on your,
and the cupping of my tailbone. That was
right. So here's what we see. If you're about to have a period, sometimes we think it can squirt that endometrial tissue out your tubes and into your body and create endometriosis in that way. But the other thing that it does is if you have a fall, if I can get this right, and it pushes your tailbone forward, now it's in the way for you having intercourse. So that if you have pain with deep penetration, it is often your partner running into that tailbone, and it hurts when that happens. The other thing that happens, it was really weird. We learned when we were treating some headaches that were chronic and were going to the ER several times a month. And we were working up here, and that was working for a lot of them. But the worst ones, it wasn't. We found that when your tailbone is actually at the very bottom of your spine, if it gets pushed forward, which is what happens in a fall, and it gets pushed forward a half an inch, it can actually pull on the other attachment of your dura, your spinal cord at the base of your skull, and give you headaches largely right here at the base of your skull, or sometimes up here where they attach. So when we go in there, as I think we probably did with you, when we go in there and we feel a tailbone that's pulled forward, we're going to go ahead and start pulling that back. And we see a tremendous amount of relief for people that do have head and neck pain, in addition to the improved intercourse, improved deep intercourse. Anyway, so
I mean, it makes sense. It's
yeah.
The whole body is connected, right? So if something's pulling here or whatever, I mean, I've talked to endo patients who had a lot of shoulder pain, right? From adhesions that had stretched up into their shoulder. So,
Right.
or thoracic endometriosis that was causing all types of wreaking havoc on their diaphragm. So I really appreciate you both so much for being on the show. Thank you for sharing. Did we miss anything? Did we cover everything? Wonderful.
I think so.
Yeah, don't walk, run to Larry and Belinda. Go if you can. It's the best thing that I did. And I have 2 beautiful babies because of it. Well, they're not babies anymore, I wish.
They're getting older, right? Well,
Yeah.
Larry, thank you for all your work and everything you do. Jill, thanks for being vulnerable and sharing your story with us. And I appreciate you. And thanks for being on the show.
Well, thanks for having us.